I'm Claire Newton. I'm a psychologist, speaker, trainer, and coach. Trauma is our emotional reaction to a shocking, unexpected event. The kind of event that is way beyond our normal human experience. Events that include being threatened, that you may be injured, thinking that you might die. It's kind of events where you witness people being hurt and injured, or even dying. And in KwaZulu Natal, the violence, the looting that we've been witnessing all around us in our neighborhoods is exactly that kind of a traumatic event. And when people experience that kind of traumatic event, we know that they're going to react with a range of emotions and physical reactions, mental reactions. And these are very, very normal reactions. Not a sign of weakness, just the normal reaction to these incredibly abnormal events. So when we talk about trauma, you can be exposed to the trauma directly. In other words, it's happening to yourself. You could be witnessing something happening to somebody else. Or you could just learn that a member of your family or a friend has been exposed to this kind of trauma. So although you may not actually be in KwaZulu-Natal or in Gauteng experiencing it yourself or witnessing it yourself, knowing that family members and friends are going through these traumatic times is enough for you to possibly experience trauma yourself. So as I said, following a traumatic event, most people will experience a range of emotions. And sometimes those emotions are quite frightening, quite scary, quite confusing. We classify these reactions into 4 categories. The way that your body responds, your emotions, your thinking, your kind of cognitive functioning, and your behavior. When it comes to our body's reaction, most of us know how our body reacts in an extremely stressful situation. That whole adrenaline reaction is what we're talking about. We are shaking. We have a racing heart. Our mouth goes dry. We're sweating. We may even experience some kind of indigestion. We can experience difficulty in falling asleep or staying asleep. There can be a change in our sleep patterns. We can experience bad dreams and nightmares. Most people will feel incredibly tired. They will just lack energy. They will just lack drive. We may experience a change or a loss of appetite. Some people will want to eat more, and some people will not want to eat at all. A lot of people will hyperventilate, so their breathing will become quite sort of fast and shallow, and they may experience some sort of dizziness. There may be headaches, there may be muscle aches, especially those muscles around our neck and shoulders where most people will feel some kind of tension. Chest pains, and just general kind of aches and pains that can't be explained for any other sort of known reason. We talk about, as psychologists, we talk about hypervigilance. People become hypervigilant. So when you're vigilant, you're very aware of what is going on around you. With hypervigilance, we become kind of almost super aware. In these times of riots and looting and so on, we'll be incredibly aware of what is happening outside. What is that noise? What is going on? Very alert to any kind of form of danger that you yourself may be in or our family may be in. We also experience an exaggerated startle response. So when somebody gives you a fright, we get startled, we jump. And what we experience as a result of trauma is that becomes so much more exaggerated. A door bangs, it sounds a bit like a gunshot, and people jump out of their skin in an exaggerated kind of startle response. So those are the ways that our body will react. And again, and I'm going to keep repeating it, this is very normal. You are not losing it. You're not going crazy. These are the normal reactions to these very abnormal times that we're going through. When it comes to our feelings, our emotions, of course, everybody's unique and they'll experience a different range of emotions. But some of what we can experience will be feeling extremely vulnerable. And I think that most people can relate to that. I've heard some of my clients talking about thinking, being locked in their homes and thinking about, what am I going to do when these looters come? What am I going to do when these mobs come? I don't have weapons. I don't know how I'm going to defend myself. They really did feel incredibly vulnerable. Some people will panic and experience those sort of panicky feelings just thinking about some of the past events that we've gone through. When some kind of memory is triggered, it can bring up all of those bodily reactions that I spoke about just now, that kind of adrenaline reaction. Some people will really need to talk about what they've been going through, and other people will not want to talk about it at all. We'll feel insecure. We'll feel frightened. We may be super suspicious of, somebody who's just walking down the street because we've been aware that the people are coming. Our patrollers that have been around have been putting on WhatsApp messages, that how many people are walking up a particular road or towards a particular mall. And so we've become extremely aware of, that the mobs are gathering. We may feel violated. We may feel exploited. Certainly, a lot of us will feel powerless. I spoke about that vulnerability. And along with that comes that powerlessness and that helplessness. I've certainly felt incredibly helpless. And I mentioned that in the introduction. For days, I was just, in shock and just watching what was going on in the sort of electronic media, feeling horrified and completely helpless. And that was part of my motivation for this series of, this is something that I can do to not feel quite so helpless. People will feel out of control. There'll be lots of anger. Anger is a trauma reaction, but we don't want to respond to that anger in inappropriate ways. And so I'm going to talk about what to do with your anger in a little while. There may be self-doubt after the event, when we've got time to reflect and think back, what I could have done and what I should have done and so on. Often there will be those feelings of self-doubt. I could have, I should have, I should not have, perhaps, thinking about ways that they could have done things differently or better. And again, I'm going to talk about that because I don't want you to let those sorts of thoughts run away with you. Knowing that you did the very best that you could at the time is enough. So those are the kinds of feelings that we may experience. Our behavior can change in quite unusual ways. One of the most common responses in terms of our behavior is what we call social withdrawal. People just no longer want to socialize. They don't want to be going out and spending time with people. Now, because we're not only dealing with the violence and the looting and the trauma, but we're also dealing with COVID. Already we've been in lockdown. Already our kind of social interaction has been, very, very restricted. So you may not even notice this as, a particular reaction. But just look out for not wanting to interact with people, not wanting to engage with people particularly. There's also a tendency to want to avoid anything that is related to the event, to not be in those places where the event happened. Perhaps not to watch the media and see those horrific video clips that we're watching of the rioting, the looting, the violence. Some people will tend to have an increase in turning to drugs and alcohol as a way of coping. And there'll be tearfulness. For us ladies, we get away with it. People expect us to cry and to be tearful, but it's really hard for some of the men who just have these unexplained, sort of no apparent reason, just to feel tearful, to cry. And I just want to say to you men out there, you're also human, and this is one of the reactions to trauma. When I work with clients, especially some of my clients in the corporate world, and I say to them, that if those tears come, because they can just suddenly be triggered in a meeting perhaps, I say to them, you don't have to embarrass yourself and allow those tears to come out perhaps in that meeting or in a place where it might feel uncomfortable. But later, just think back, what triggered it? And when you're in a safe place, at home, your car, allow those tears to come. Because when those tears come, we do feel better. We know that tears are healing. And tearfulness is one of those trauma reactions. We will struggle to concentrate. We will struggle to focus. Our short-term memory can be impaired. We can forget all sorts of things, simple little things. I found myself yesterday just going up to my bedroom to get something. And I got there and I just could not remember what it was that I'd gone for. It's those kinds of silly little things that can happen. Poor problem solving, difficulty making decisions. And I'm not talking about complex problems and, big things at work. Well, of course, those will be affected. But I'm also just talking about those everyday things. What should I wear today? What should I cook? When we go shopping, we've been struggling with, there's been limited things. We can't just go and get the ordinary everyday things. And some of you may find yourself really struggling with, well, what should I get? I'm only allowed 5 things. What are those 5 things going to be? When I get into the shop and I can't get one of them because I can't get the flour or the bread, now what am I going to buy? And those simple decisions, which for anyone who's listening to this that hasn't been through trauma, they're going like, really? That's a problem? And I'm saying when you've been through trauma, that does become a problem. Simple decisions, simple problem solving can become really, really difficult. And I'll tell you about how to deal with that in a moment. When it comes to our thinking, one of the reactions that most people know about just by watching movies are flashbacks. And a flashback is when that imagery of the event just comes back to you very, very vividly. And often when we have those memories and those visions and that picture kind of coming back to us so vividly, our body then goes into that panic state, exactly the same feelings that you were feeling when that trauma was happening. Your heart starts racing, your breath becomes fast and shallow, so you're breathing, that hyperventilating, you start shaking, and just really, really feeling scared. And the flashbacks are something that is, as I said, is quite well known, but not everybody is going to experience that. So just to sum up then, our feelings and our reactions are divided into those 4 categories. Your body's reaction, your feelings, your behavior, and your thinking. And I'm repeating myself deliberately because I want to remind you that these are the normal reactions that most people will have. Some of them you may have, some of them you may not have. Everybody is unique. But they're normal reactions to an abnormal event. This is not a sign of weakness. This is just the reaction that we all will experience. And when people ask me, well, Claire, how long is this going to go on for? Because it really feels, this is horrible. And I say to them, don't worry, it will pass. And generally we expect, most people will start to react quite quickly, but some people may have delayed reactions. They may think they're really, really coping well. And then in a few days' time, it only starts to hit them. Generally, we talk about it lasting for about 4 weeks. But even during that 4 weeks, it starts just to get less and less and less. And you start to get back to normal thinking, normal behavior, more of what you experienced before the trauma. I'd like to make the point that these normal kind of reactions to trauma are not PTSD. It's not post-traumatic stress disorder. As a psychologist, we don't make a diagnosis of post-traumatic stress disorder at all until after about a month of these events happening. I'm not going to talk about post-traumatic stress disorder at this point, because as I said, that's something that's now a complicated case of reactions. It's long-term, and I'm just dealing now with what we're experiencing or likely to experience as a result of this violence and looting that's happening to us right now.